Can a child's juvenile arthritis go into remission? Imagine a child who has been living with joint pain and swelling. You might wonder if someday those symptoms could disappear completely. The good news is that juvenile arthritis can go into remission, meaning the disease becomes inactive and symptoms are not present. But how often does this happen, and what does it really mean for a child's health? Research shows that nearly half of children with juvenile idiopathic arthritis, which is the most common type, can achieve remission without needing medication by their mid to late teens. This means their joints are no longer inflamed, and they feel well. About 25% of children are in remission while still taking medication, which helps keep the disease under control. However, around 25% still have active disease into adulthood, meaning their symptoms continue. The chance of remission depends on the type of juvenile arthritis a child has. For example, children with systemic juvenile arthritis, which affects the whole body, tend to have higher remission rates, around 70%, especially off medication. On the other hand, those with rheumatoid factor-positive polyarthritis, from that affects many joints, have lower chances, about 18%, of going into remission without medication. In children with oligoarthritis, which affects fewer joints, remission off medication has been reported in between 39 and 66% of cases over several years. Despite these positive outcomes, some children still need ongoing treatment, including advanced therapies like biologic medications, to prevent joint damage and keep symptoms at bay. It is very important to understand that if juvenile arthritis is not treated properly, it can cause joint damage, abnormal growth, or disability. Early and effective treatment helps reduce these risks. Regular visits to a pediatric rheumatologist are essential to monitor the disease and adjust treatment plans as needed. In summary, juvenile arthritis can go into remission, especially with modern treatments. Many children experience periods where the disease is inactive, either while still on medication or after stopping it. But because each child's situation is different, ongoing medical care is key. If you have concerns about juvenile arthritis, always talk to a healthcare professional who can provide guidance tailored to the child's specific needs.